How to inject Ovaleap using your Ovaleap pen. This video is intended to be viewed by patients who've been prescribed Ovaleap. Ovaleap is a medicine that is administered in the form of an injection directly under the skin via subcutaneous injection using an injection aid, the Ovaleap pen. Ovaleap is available in 3 dosage capacities. The Ovaleap pen can be used with all 3 dosing cartridges. Always use Ovaleap exactly as your doctor has advised you. Please ask your doctor if you're unsure about anything. This video will show you how to self-inject using your Ovaleap pen. Before watching this video, please read the entire consumer medical information leaflet contained in the Ovaleap cartridge box, as well as the instructions for use leaflet contained with the Ovaleap pen box. Before using your Ovaleap pen for the first time, please watch this video all the way through. This video will help you to learn how to use your Ovaleap pen by breaking the process down into 5 steps. Using an injection pen is a new experience for many people. The Ovaleap pen has been designed for convenient self-administration, and this short video shows you what to do. Becoming familiar with your Ovaleap pen. The reusable Ovaleap pen has several features to help you self-administer a preset dose of Ovaleap correctly. You can select your dose by turning the dosing dial. This large display window contains the dose indicator showing the amount of Ovaleap given with each use. Dose amounts are shown as numbers here. The clear cartridge holder lets you see that there's medication in the cartridge, and the printed scale on the cartridge helps confirm the amount of medication remaining in the cartridge. Hygiene is important when you're preparing to administer Ovaleap. Before you start, wash your hands. Remove both your Ovaleap cartridge and Ovaleap pen from the fridge and let stand for 30 minutes to reach room temperature. Don't leave your Ovaleap pen and cartridge out of the fridge for more than an hour. And do not expose Ovaleap to any temperature over 25 degrees Celsius at any time. This step is not absolutely necessary, but injecting room temperature medication may be more comfortable than injecting cold medicine. Place your Ovaleap pen and all its contents on a clean surface. Ensure you have all the necessary items before you begin. This should include your Ovaleap pen, cartridge, needle for injection, and a sharps container. Take a moment to examine the pen and the medication. Check that your Ovaleap medication has not expired. The expiry date is found on the cartridge box and the box it came in. Do not use the Ovaleap cartridge if it has expired. Instead, call your doctor, nurse or pharmacist and ask for a replacement cartridge. Preparing to self-administer in 5 steps. Step 1. Loading a cartridge. Pull the green cap off the pen, then unscrew the pen body from the cartridge holder, like this. Check to ensure that the dose indicator in the display window reads 0. If the dose indicator does not read 0, you can press the correction button located on the top of the pen to dial back the dose. To load the cartridge into the pen, the internal plunger should be fully retracted. If it's not, just wind the black collar in the direction of the white arrows as far as it will go. Now, load the cartridge into the clear cartridge holder with the metal cap first. Then firmly screw the cartridge holder and pen body together, making sure that the plunger is lined up with the cartridge plug. Step 2. Priming your Ovaleap pen. Peel the outer protective layer from a new pen needle, then firmly screw the pen needle onto the cartridge holder, making sure it's straight. Now, remove the outer needle protector and the inner needle cap from the pen needle. Remember to keep the outer needle protector. You will need this after you complete your injection for removal and disposal of the needle you've just used. It is important to prime the Ovaleap pen before each injection. This is to expel any air that may be inside the needle and the cartridge and to ensure correct flow of Ovaleap through the pen tip. To prime the cartridge, ensure the dose indicator is set to 0. Then dial 1 click on the dosing dial. If you accidentally dial more than 1 click, press the dose correction button located on the top of the pen. This will move the dose back by 1 click with each press. You can now dial the priming dose again. Hold the Ovaleap pen with the pen needle pointing upwards. slide the injection button towards the needle and hold it there until the numbers in the dose indicator return to 0. You should see a small amount of liquid appear from the needle tip. Important: if no liquid appears, repeat the priming steps as many times as necessary until liquid does appear at the tip of the needle. Step 3. Selecting the dose. Make sure the dose indicator shows 0. Your doctor will have advised you what dose of Ovaleap you need to inject. Set the dose prescribed by turning the dosing dial to the required dose amount and ensure the number is centrally aligned in the dose window. If you dial in a dose that is too high, firmly press the dose correction button to dial back to the prescribed dose. If you click back too many times, just redial the required dose. Remember to always use the dose correction button to dial back to the prescribed dose. Never attempt to turn back the dosing dial, as doing so may damage the Ovaleap pen and result in inaccurate dosing. Ensure that the correct dose is now centrally aligned in the dose indicator display window. Now your Ovaleap pen is ready for injection. Step 4. Injecting the dose. Your doctor or nurse will have advised you where to inject your Ovaleap. Pinch the skin gently and fully insert the needle straight into the skin. Suitable injection sites include lower abdomen, upper outer thigh, or upper outer arm. Avoid the navel or groin. Now, inject the full amount of prescribed medication by sliding the injection button towards the pen needle and hold it in place for approximately 10 to 15 seconds. Now you should see that the dose indicator reads 0. After this, you may remove the needle from the skin. If 0 does not appear in the dose indicator, don't worry, just follow these steps. Clearly identify the number shown in the dose indicator. This dose is referred to as a missing dose. A missing dose simply means that there was not enough drug in the cartridge to administer the full dose. Record the amount of this missing dose, as you will need to inject the same amount to ensure you've received the full dose of Ovaleap that you were prescribed. Now, all you need to do is load a new cartridge, carefully following steps 1 through 3, and then inject the remaining missing dose amount. Remember to use a different injection site to avoid the risk of soreness at any one site. Step 5. After the injection. Now that you have successfully administered your Ovaleap, it's time to dispose of the needle. Reattach the outer needle protector and unscrew the pen needle only. Dispose of the used pen needle in an approved sharps container. Remember to keep your pen for use with your next injections and make sure you do not remove the cartridge before it is empty. Remember to replace the pen cap after each use. Always store the Ovaleap pen without the needle and with the green cap in place. Always store the cartridge protected from light. Immediately after use, place the Ovaleap pen containing the cartridge back into the fridge until you're ready for your next injection. The fridge temperature should be between 2 and 8 degrees Celsius. Please refer to the instructions for use for further important information about how to store your Ovaleap pen and cartridges. Place your used Ovaleap needles into a sharps container and return to your clinic or pharmacist for safe disposal. Thank you for watching this video. If you have any other questions about how to use your Ovaleap pen, please ask your doctor or nurse for advice.